our colleagues have been gathering the questions as we run through the webinar. And I think we might just start, if we have all our presenters here. The first question, I think there was a number of questions that were coming through at the beginning in relation to our colleagues from ICPO have been getting a lot of attention in terms of the barriers to physical activity. And can you expand a little bit on that a bit more how they're being addressed?
They would be different for everybody, the barriers. I don't know if they're being addressed properly. They're still there. There's nothing that can, people are asking on the questions, what are the barriers? I think that the video explained what the barriers are. They're totally different for every person. In physical activity, and there's a huge amount of pain involved, especially as you get older. But if you have a sports injury, my grandson was involved in the sports last year, and he got an injury, and he's only 11. But that was it. He was out of sports for the rest of the summer. So it's really injury. Is there something? Is there a system there for treating people of injuries at sport during these projects? And stigma is mentioned as well, and pain, and which was the most difficult one. But both are very huge to everybody. But it depends on the individual whether it's the stigma or the pain. For me, it would be the pain of how far I can go, and if I go too far for a walk, will I need assistance in getting back? So there's a lot involved. I was listening to everything there, and I was thinking, all of the schools are closed during the summer, and all the sports halls are there unused. So for people living with obesity, we would need a closed-in area like that would be ideal for opening up to just letting us have a walk around or doing a little bit of exercise. Or nobody mentioned dancing. A little bit of dancing would be great. I know for people, Robert mentioned people in sport. I know it's all sports orientated, but there is an element of people don't want to do sport, but they might do a bit of dancing. So for people living with obesity, that would be an area I would think that you could, hone in on as well.
Thank you, Maura. There is a number of questions also looking at the barriers to physical activity for people living with obesity and how this has been addressed in policy. Robert, would you like to start by answering that?
Yeah, certainly. Just very interesting to hear just the experiences coming through in one of the other presentation, and it bore out for me what we had heard when we done the drill down across a wide range of groups and quite a number of people within those groups. And we're very aware that there are a number of barriers to physical activity and sporting activity for those living with obesity and overweight. And they go right down through the economic factors, the costs of being involved. A lot of people living on benefits or reduced incomes find it difficult to be involved. It could be transportational issues in terms of access to the transport network, particularly if you live in rural areas, and the distances to be travelled to get to facilities. It can be logistical barriers in terms of the usage of changing rooms and the dignity questions and issues there. Even things as simple that came through in some of the discussions as having some sport, type of leisure wear to wear going to these places, and also restrictions in terms of being able to actually use some of the equipment in some of the facilities. And of course, there are others such as that came through very strongly in terms of attitudinal barriers, and we've heard the word stigma mentioned there, insensitivities, people just being generally critical. I was astounded in one of our group focus groups that we heard from folk who felt they were actually being mocked by those around them. And to me, that was just cruelty and designed just to keep people excluded and away from all the opportunities that were available. But that takes me to the limitations that there are in programming. And of course, during the winter months and the schools are active, there can be limited time and limited programming to be active. So I think that we do need to look at the fact that in the evenings and across the holiday periods, the schools' estates are closed, and there are great facilities there. They are on the doorstep of many. And we have a programme that has really been operating this past 2 years in pilot form. We want it to grow and expand during the period of this new strategy. It's your schools, your club. And that is about opening up the schools' facilities to the local community. And I think it was Maura mentioned that we need to have this holistic approach to create the opportunities and to create the proper access as well. I think there's an educational barrier there, and it links to the attitudinal thing as well, in terms of some people just don't see the importance of being active. They have not got the messaging, or if they've heard it, they haven't accepted it. They haven't personally appropriated it to themselves. And there's like, I'm all right, thanks, where I am. And that just consolidates folks in that sedentary lifestyle. So, you know, and added into just picking up those physical barriers as well, such as injuries and pain issues, and accompanying other health issues as well. We're very acutely aware of that. The challenge for us at this point is, as we develop the action plans, how do we translate that knowledge into meaningful change and meaningful programming and meaningful access and very much targeted funding to make the difference that's required in this area.
Thanks, Robert. And I think that opens the question about, you know, the behavioural change approach to engaging people with attitudes around physical activity, engaging all people with the importance of physical activity. Fiona and Catherine, would you like to comment there in terms of practical examples from the evidence base in terms of what has worked really well, initiatives for people with obesity, living with obesity, in terms of engaging with physical activity?
Yes, so there are a number of physical activity initiatives we're working on in the policy space here. Now, I would like to thank all of the patients very much for outlining very clearly the barriers that they're facing. Also, it would be important to note that actually it's not just people living with obesity. We would have a lot of people who would be living with other chronic conditions, arthritis. I mean, a lot of them are overlapping. A lot of patients with one would have more than one, but like basically what we need to start looking at, and we've already had discussions with Sport Ireland and with the HSE around this, and we're already trying to expand provision of this on the ground, is looking at how do we get people who may have a number of conditions, or who may be older, or who may be at risk of frailty, how do we get them to engage more with physical activity to protect them better and to enable them to be more active, and the mental health benefits, and to overcome some of the barriers. So what there are at present is there's a number of initiatives that are out there at present. They include XWell and a lot of this Launch a Care Integration Fund projects that my division in the Department of Health is funding under Laura McGahey. So basically you would have, you know, for example, one of the MS charities is funded to offer some tailored exercise opportunities for people who are living with neurological conditions. There are various others that are aimed, for example, keeping fit is aimed at people who are perhaps, you know, a little older and where frailty prevention is very useful. Where we need to do more work is to join all of these up and to have a strategy that they would be available in all areas, because at the moment, as you know, the IPARC initial sort of, you know, all the arrows going in different directions, there's a lot of very useful programs that are out there to try and help people at various stages of fitness and conditioning, including the frailer, how to keep them more active and to have it more coordinated such that there is, you know, all the arrows pointing in the same direction. And that's where I think we have to work. And we've had a lot of very useful meetings with the HSE and Sport Ireland in terms of progressing this further. We're also reviewing the National Physical Activity Plan, and we'll be planning to put a lot of the information, for example, that was offered this morning in terms of barriers, to kind of take all of that into account in generating the next version 2.0 of the National Physical Activity Plan, and also to bear it all in mind in terms of implementing the national sports policy as well. I don't know if Benny and Catherine would have anything else they'd maybe want to say on their sides.
Just to pick up on a point that Robert brought in, the you know, that programmatic solutions are really useful in some contexts, but they're not the sole answer. And so I think it's also important to think of the system and the kind of systems approaches that we use, not just at a national or even regional or county level, but even at a very localized level, at a community level. And so two initiatives that jump out to mind that try to replicate that. One is community sports hubs, which try to address a lot of the barriers that people have highlighted, be they access to facilities or transport or accessible facilities in themselves, that there's steps in swimming pools rather than ladders. But that also integrate that into providing supports to the community, so that there are the right coaches and supports there, that the right social atmosphere there, that people feel welcome, that they don't feel stigmatized. And so community sports hub kind of take that wider approach to developing sport and physical activity within a community setting. And the other initiative that jumps to mind is Active School Flag, which does something similar but in a school setting. So it's trying to work on the culture within schools rather than just rolling out a program in the schools. It's a whole school approach. It involves children, teachers, principals, not just a PE teacher, but the entire school.
And Catherine, did you want to come in there?
Yeah, thank you. And thank you for a very interesting session. And I can echo Benny's points about hearing from individuals living with obesity. I think that was enlightening. And I think we need to do that more and listen to them more. So thank you for sharing those experiences with us. I have 4 points to make. One is the type of physical activity. There are so many different variations on the type of activity you can do. So really, to address any barriers that you perceive yourself, it's to find the activity that works for you. Dancing, walking, swimming, whatever, but there is an activity out there, and it's to find it. And where, the second point is where you choose to do the activity. For some of you, some individuals working out at home, actually, not even leaving your home, but actually doing the physical activity at home. And one thing that the pandemic has done is it has made us all much more aware of online resources to help us to do this. So it could be in your home, it could be in your local community, it could be going to actual structured settings like gymnasia or sports club settings. But the location of the physical activity, any physical activity you can do is better than none. So using whatever resources are available to you. And the third thing is to advocate. Both Benny and Fiona have mentioned something called the systems-based approach. So if we're going to make our environment suitable for physical activity for everyone, then that requires planning. It requires transport, it requires education, it requires health, and it requires the sport communities all to come together to make that work. So my call is to the Association for Individuals Living with Obesity to advocate not only within the traditional sectors, but move outside of the more traditional sectors to really make our environment conducive to physical activity. Have street furniture so that if I need to take a break and have a sit down, I have street furniture that allows me to do that, so I can walk further and so on. And the final thing is, the question was about barriers and facilitators to individuals living with obesity engaging in physical activity. I'd suggest that in Ireland, we don't know this information very well, actually, particularly when it comes to physical activity. We need to do more research to find out what programs, what interventions, what supports are necessary and will actually make a long-term difference in terms of addressing the challenges of living with obesity for individuals. Thank you.
Thank you, Catherine. That was a really comprehensive answer. I was going to say succinct, but it was certainly comprehensive. Thank you very much. Just to expand on that a little bit, and it's coming into the questions as well, in terms of the really practical examples from the evidence base in terms of initiatives for people living with obesity, or otherwise in terms of initiatives that have worked really well in terms of school initiatives, community initiatives, people in low income groups. I did manage to attend the iPark online webinar recently, and there were some really, really good ones, what I thought were really excellent ones around getting kids going to school, walking, that type of initiative. Do you want to talk about that a little bit? The types of really, really evidence-based examples of initiatives that work really well for people living with obesity in terms of communities, schools, or low income groups, or people in general.
Oh, sorry.
Sorry,
Yeah,
go
Benny.
ahead.
What?
Um,
No, go ahead, Benny.
oh, you go ahead. You go ahead, Catherine. Sorry.
All I was going to say, as part of iPark, we had to identify what we called exemplar practices or initiatives. And we selected 10 of those, all because they either had evidence of effectiveness, that means they change physical activity levels, or they had evidence of implementation. And what I mean by that is the reach was massive. They were activities that were acceptable to general population and that covered rural and urban environments, low socioeconomic groups, whatever. So they were either effective or implemented very, very well. And what we did was we then studied those. The challenge in naming actual initiatives is that it really depends on the individual that you're talking about. So it might appeal to men or it might appeal to women. It might appeal to younger people. It might appeal to older people. So it's very difficult to say this initiative is effective. However, if you go onto the iPark website, you will see examples of interventions that we were working with. Obviously, walking is by far the most popular form of physical activity for this group, followed by swimming, or anything to do with aquatics or water-based activities are also very important. But whether they impact on levels of physical activity or whether the outcomes are more to do with psychosocial well-being, for example, or other outcomes, it depends, and then you need to get into the specific initiatives.
Okay, thank you. Penny, do you want to come in there?
No, I was going to say something very similar, that iPark did pick up on 10 exemplar interventions. I mentioned 2 of them, community sports hubs and active school flag, which were both exemplar interventions. And I thought were of interest because they go a little bit beyond the pure programmatic approach. There are examples there, as Catherine said, they tend to be very tailored towards very specific cohorts of the population. So Men on the Move is a program that jumps to mind, which is targeting, older men who are inactive, trying to build on the social cohesion that men can sometimes create. So it's a men-only group. Trying to draw them in, often working with things like men's sheds and those kinds of associations where men are congregating, and then creating, gradually creating opportunities for them to maybe start exercising a bit, possibly improve their diet, and become more aware of their health at present and how they might be able to improve their health going forward. That's a very specific initiative for a very specific cohort of the population. We'd be here all day listening through all the initiatives that we have for every cohort. So as Catherine said, it's being aware that there's one example, but it's multiplied by hundreds in order to have something that are specific to geographic location, particular target group that's being worked with, and also being outcomes focused. So when the first time an initiative is trialed, may not work, and then it's tweaked and it's changed slightly. And so the measures now that we have that we can actually evaluate, actually these initiatives are working or they're not working, or what are the active ingredients that are allowing these initiatives to work, is a really powerful place for us to be, and I think will allow us to make progress going forward.
Thanks, Benny. I was going to, the final, we're almost out of time, but I just wanted to maybe expand a little bit on that whole systems approach that has come up in a couple of the questions as well, that I think was mentioned by iPark and also by Robert in the Northern Ireland strategy. And I wonder, Robert, maybe you might come in first and just expand on that a little bit. And I know there are moves in Northern Ireland in terms of engaging with a whole systems approach to obesity and physical activity and well-being in general, and also in the Republic. So maybe you might just comment on that, and I might go back for a comment from one of the other speakers in terms of what's happening in relation to the healthy communities and how we're feeding into that approach before we finish off.
Very glad to, and just want to thank colleagues for all their inputs this morning. It's been very, very informative. And I think the biggest realization for us and the importance of this new strategy going forward is that whole system approach and the collaboration between departments that will underpin it. We've done a bit of that in the previous strategy, but we just see it as absolutely critical. If we really want to make real change and make a real difference, then it has to be that holistic approach with each of our policy and strategy pillars, recognizing and seeing that they have a role in it. It's not disability and autism and obesity prevention is not just the sole responsibility of the Department of Health. There are responsibilities in my department for communities. There are responsibilities in the Department for Education. And I think one of the very important messages that we have received is that a key area of this particular battleground, and I know that's a very strong word, but is in the schools. And it's about looking at our children at the youngest possible age and encouraging their fundamental movement, giving them the skills, but as well help them to understand why we're encouraging them along that pathway. Because we were astounded when we spoke to teachers in Key Stage 2 primary and then up into the secondary level, whether it was secondary schools or grammar schools, who were very open in saying that there were children arriving with them and them having a competitive sports menu for them to get involved in. And they didn't have the fundamental skills in terms of the ability to run at pace along certain lines diagonally, eye, hand, and coordination. And, it sounds very strange, but the very fundamental things were missing. And it was because there is that and has been that emphasis on the academic, the reading, the writing, the arithmetic, and other things that you expect. Physical education in schools has that lower priority. It has that lower priority in terms of inspection, because we have found that PE in schools for our youngest children is not in the school's development plan, therefore it's not inspected, and the schools are not then accountable. So there needs to be a change there in education, and I'm saying education because this is a strong example in my mind at the moment, but it cuts across other departments as well. And as we have done in terms of the wider disability piece through our Active Living No Limits Action Plan, we have drawn our partners in, not just departmental, but in councils and all the various bodies out in society, to say we each have a role here. One body cannot deliver this on their own. We each have something to contribute. And for me, for this strategy and for the whole subject of obesity prevention, that's the pathway we have to go along.
I think that's a very good note to finish up on. Unfortunately, we have run out of time, but I thank you all for a really insightful and interesting and wide-ranging discussion, where I think we're all a lot more informed, certainly in terms of the kind of barriers and facilitators in terms of living with obesity and engaging in physical activity. So thank you all very much for taking the time to tune into this webinar. A special thanks to our speakers for taking part. Thanks to everyone who's involved in the organising the webinar behind the scenes. Particular thanks, I would say, to Anne Parle and Sally Griffin from our team, who did a lot of the work behind the scenes in organising this session. We encourage you to tweet about the event. When doing so, please use the hashtag #ObesityForum. And we will be emailing you a quick survey in relation to today's event. We would be very grateful if you would take a few minutes to complete it. And I would like to remind you that the presentations will be available online after the event, or they can be requested via email from obesityforum@safefood.net. So thank you all very much, and we look forward to seeing you again soon. Thank you.
Thank you very much.
Very much.
Thank you.